yet. He may be joining us later, but I'm here to answer any COVID Q&A questions. In terms of what's come out recently, there hasn't been very many headlines, in terms of COVID or what's happening right now that I've seen. There are some interesting studies going on with long COVID. Project ECHO is one of them. And then there's an NIH study as well that's bringing out some interesting information in terms of myalgic encephalomyelitis, chronic fatigue syndrome, and the effects of that with COVID. One thing that I thought was kind of interesting while I wait for you guys to ask questions was that I think they said that 1 to 2 million Americans were suffering from that pre-COVID. And post-COVID, it's around 8 to 9 million. So you look at the difference between that, I think that's going to be severely debilitating and lead to a lot of disability in our country. So I thought that was interesting, but otherwise, nothing new that I've seen. So I'll wait your questions.
As always, you can type your questions into the chat window. And if someone doesn't feel comfortable with the chat window, do they want to unmute themselves and ask their question? I guess that's a no. All right.
I think that Jennifer said she was wondering about local outbreaks. So DC is actually doing pretty well. They're at like a very low transmission rate, whereas Maryland is at, I think, about 6% at this time. So it is increasing, but not in the same way we've seen before with the, initial Omicron variant in the winter and then, into January. So the numbers are still looking okay in terms of hospitalizations. They're still not as high either. Any news about timeline? I haven't seen any news about an all-inclusive vaccine timeline.
There's not going to be an all-inclusive vaccine. Everybody just let go of that wish.
that wonderful thought. Yeah. So, I mean, they're saying that you reduce your chances of getting long COVID if you're vaccinated. Some of the numbers I've been seeing is about 50%. Those studies are still very immature, and I don't think there's enough research to really prove that yet. So I'm not sure about that. There is a lot of evidence to back up that if you do get COVID, regardless, I think it's about a 30% chance of developing long COVID. Yeah, GW is doing graduation in person. Any good news on effective vaccine on preventing long COVID? Yeah, so same answer. I think that the last thing I saw was about 50% was the number that they had so far. But I think it's going to take some time for us to really see what the effect of the vaccine has in preventing long COVID. So Paxlovid, interestingly enough, I've been seeing some stuff recently that they're going to use Paxlovid in some trials with people with long haul COVID to see if it improves. I haven't seen anything, and I don't think there has been anything about whether it prevents long COVID or not, just that it prevents severe illness. About vaccines and long COVID and Paxlovid. What about the new variant in long COVID? So you want to ask your question? I'm not sure I understand your question. Are you asking about whether the new variant has less of a chance of getting long COVID or more of a chance of getting long COVID? Okay. Yeah, I don't, there really hasn't been any distinction. I can say that. Most of the post-COVID programs I follow, like Hopkins is one of the larger ones, they're still seeing the same amount of patients coming in, even with Omicron. So I don't think there's a distinction. Yeah, just the chances between getting debilitating long COVID. So yeah, research that shows where people are mostly getting COVID.
It looks like Jade has a question.
Okay.
Hi, can you hear me?
Yeah.
Yes, we can.
Yeah. So what is meant by long COVID?
So that's a good question. There's a lot of debating definitions of that, but most of them say symptoms that last more than 12 weeks post-COVID infection. And so that could be fatigue, that could be headaches, that could be neurological changes like brain fog. These are some of the most common ones, GI changes, nausea. Those are probably the most common ones that are seen, at least. But there are some definitions that are less, like 6 weeks. But I think that the most accepted one is 12 weeks.
Okay. Thank you.
And reinfection soon after, reports of weird virus. Oh yeah, so there is some data that's coming out with Paxlovid and people having rebound of symptoms in about 10 days at day 10 to 14 after taking it. You know, I think they're still looking into that. They're unsure of why that's happening. You know, they think maybe that the body just hasn't had the experience of the virus enough. And so you have this rebound effect, but there isn't enough data or enough cases of it to change the recommendation of Paxlovid. I think still the benefits outweigh the risks, in my opinion.
Yeah, it's very rare. It's like 1 to 2%, I think, of everybody.
Oh, look, Misha's here.
Misha.
So you want to, I mean, you can answer some of them. I think I answered most of them. In terms of research that shows whether people are mostly getting COVID, you know, of course, it's the same thing about indoor, outdoor. If you're outdoors, your chances is less. Indoor, it's going to be more, especially if you're in a crowded area. So I don't know if what you're doing, Misha, but you know, I still tend to wear a mask, especially if I'm on a plane, even though I know they've gotten rid of that.
Yeah, I think I'm realizing that I'm probably not as good of an example anymore as I used to. I think, well, I realized that I start really relaxing after I have COVID, because I feel like, well, what could happen, you know, but it's also messaging. I was on the way back from work. I was listening to NPR and they were talking, you guys heard about this? They're discussing making some cars masks not optional, so it requires a mask, and some cars no need for mask. And I'm like, you know, so we're starting to, well, because the federal judge removed requirements, so now it has to be done on a local level. So we're entering this territory where things are so weird that I think, honestly, let's put it this way, you can't mandate anything and you can't ask somebody on a bus or a train to put the mask on. So your only choice is how you feel. And if you feel uncomfortable, put the mask on. Like, I think in a few months, I may start putting mask back on when I start realizing I'm too far out of that infection and my immunity is going to start slowly going down. And you know, but you also should ask the question, well, do they do anything in the cases where if I'm outside or if the risk of exposure is low? That's where I've always said, you know, outside, I tell everybody, don't wear a mask outside. I don't know what the benefit of that is so small. And frankly, you're probably potentially having some even negative impacts, right? Especially if you're trying to exercise, and if you have a mask and you can't exercise as much as you wish, well, then that's actually harm, right? Because you're not achieving your goals of exercising.
So it looks like Salome has a question.
Yeah, I have a question and 2 remarks. My question is, did I hear Ashley, I think it's Ashley, say that, well, it's not clear to me. If you are vaccinated, you had all the vaccines, do you still get long COVID? What are the chances of getting long COVID if you have been vaccinated?
I can try to answer that. Maybe
Okay.
Ashley maybe can add. Salome, I don't think there is any evidence to suggest that somehow magically vaccines protecting against long COVID. And it's moreover, what's even more concerning, we used to think that the more severe the illness is, the more likely you're going to get long COVID. Turns out that doesn't pan out. So there's some individual variations, not clear exactly what they base on. Probably something genetic, maybe some other factors like what particular form of COVID you got. it sounds like that we are maybe having a little bit less of long COVID with the Omicron, but even that I think is not evidenced. I think all of these questions are still up in the air.
Okay, thank you. The remarks I have is, I don't know if you guys heard the news that Metro possibly will have trains for mask wearing people.
Yeah.
That's one. And the second one is, I heard this morning, I think it was this morning, Prince George County is encouraging or is going to encourage people to wear masks indoor.
Makes
As I
sense.
said, it's going up there. Okay.
Yeah.
Okay.
Okay,
Thank you
so-
about long COVID. Thanks.
On that note, we are going to move on to Nina. Let me set that up. Nina, for some reason, I've lost you. There we go.
All right, can everybody hear me okay?
Yes.
All right. And let's see here. All right, and is everybody seeing my screen, about mindsets?
Yes.
Yes.
All right, so well, it's great to be here with all of you. I've got a different hat on today. Normally I'm leading the mind body, and today I'm doing the wellness talks. I wanted to talk about the mindsets that we can choose to engage in that enhance our stress resilience. And so this talk is informed by the work of stress researcher Dr. Eileen Yager at Stanford, and UPenn professor Dr. Martin Seligman, who is also the co-founder of Positive Psychology. And so it's about harnessing the power of your stress mindset to your advantage, because the mindsets that we choose towards stress have dramatic consequences on how we cope with our stress mentally and physiologically. That's what the science is showing. And you can think about mindset as the lens through which you view stress. So your interpretation of it, do you think it's threatening or challenging, for example, how you explain it to yourself, and your expectation of how you will experience it. And so looking at a definition of what stress is, I want to focus on the stress appraisal, so the stress perception aspect here of stress. So if you look at the definition given by the late Dr. Richard Lazarus, he defined stress as the relationship between the person and the environment that is appraised as personally significant and as taxing or exceeding resources for coping. And so it determines how you will actually cope with that stress. And we do know one very advantageous response is our fight-flight response, because when that gets activated and we're in danger or in harm's way, that fight-flight response enables us to get out of harm's way pretty quickly to protect ourselves. So that's an advantageous stress response. We also know, though, that chronic stress is not good for us, is not healthy. And so talking about the daily stressors of everyday life, how can we engage in this mindset that stress is helpful, that stress can be enhancing, that stress is not harmful for us or debilitating. And that's what we're talking about today. I think it's worth mentioning a couple of studies that demonstrate this aspect of a helpful stress response. So the study, there was a study at Yale that Dr. Alia Crum and colleagues conducted where people were given 2 milkshakes, and one milkshake had the label that it was a sensible milkshake, that it was low in calories and healthy. And the other milkshake had the label on it that it was the indulgence shake, that it was high in fat and high in calories. It turned out to be the same milkshake, but it was that was not known to the participants. And what they found was when people believed that they were consuming the high calorie indulgence shake, that their bodies, their physiology responded as if they had actually consumed more calories. There was another study that I wanted to mention, also conducted by Alia Crum and Ellen Langer. And what they did was they talked to hotel attendants at a hotel that were responsible for cleaning the hotel rooms. And they checked in with them about how much exercise they were getting. And they didn't think of themselves as getting much exercise or activity, even though they were pretty active in their role of cleaning rooms. And they found that compared to the control group that received no information, when the hotel room attendants were informed that their work was good exercise, they actually showed improvements in health. And this was measured by weight and blood pressure 4 weeks later, even though they didn't add any more exercise to their routine. So when we think about our stress as helpful, it does change how our body responds to it. Our body has a physiological response that can enhance our performance and productivity, improve our health and vitality and energy, and facilitate our learning and growth so that we get better at stress. More specifically, the 3 best mindsets to have towards stress resilience are 1, stress is a challenge, not a threat. Stress causes social connection. Stress causes me to reach out to others for help. Or if someone else is in a stressful situation, I can help them. Stress causes learning and growth and creates meaning. And so let's take a look at how this might play out. So if we're viewing stress as a challenge, not a threat, you can think of this maybe in a performance situation where you're about to give a public presentation, bless you, a public presentation, or you're about to, play on your sports team. So if you take this mindset that this is a challenge and my body is actually, feeling the adrenaline pumping or the heart racing, physiological sensations in the body, viewing that as something that is energizing you and focusing you, you can feel more motivated and more energetic and more in a place where you can handle it and perform well. And physiologically, one of the stress chemicals at DHEA actually gets activated, which helps you actually learn and grow from the experience. If you reach out to others while experiencing stress or help someone while experiencing stress, oxytocin gets released, and oxytocin helps with social bonds getting strengthened and can cause you to feel connected and versus isolated and part of a group and in touch with our common humanity that we all suffer and struggle with something, and by connecting with each other, That's very helpful. I've also read that oxytocin actually is protective, can be protective of our heart and improve our immune system. The third response that is very beneficial is viewing stress as an opportunity that you'll grow from and get better at handling future stress. You know, that stress is a part of life. We don't always control, you know, have control over how much stress we're going to have in any given time period. And so if we can bring that more welcoming attitude to our stress and know that we're going to get better at it, we're going to grow, there's going to be maybe even some meaning created from having gone through the stressful experience, maybe getting you in touch more with your values and what's important to you. Because, you know, most people that have fulfilling lives, it's not without stress. There's one other, you know, set of mindsets towards stress that I think it's also very important to mention that impacts how we mentally cope with stress. And that's how we're explaining our stress to ourselves. So similarly, it's a mindset. So in terms of how you explain stress to yourself, do you explain it in a pessimistic or an optimistic way? And it turns out it has everything to do with the 3 Ps: personalization, permanence, and pervasiveness. And so optimists tend to, when a bad event happens or a stressful event happens, they think that it's a temporary thing, that it's not always going to be there. It's not going to last forever. And they don't, you know, they don't think it's pervasive. They realize that it's affecting one area of my life. Other areas are, you know, going well. And that they don't blame themselves entirely and personalize it. They know that this stress was caused by many other factors. And the pessimist, it's just the opposite. When something bad happens, they tend to think it's permanent, that it's always going to be this way. It's pervasive, it's affecting every area of my life, and it's completely personal, that I am completely to blame for it. So as you can imagine, people that tend towards more anxiety and depression, you know, have these ways of explaining stress to themselves, the pessimistic style, and that can make you feel, you know, more anxious and depressed and hopeless and helpless and, you know, not capable of handling stress. And why even bother? There's also a way of thinking about it in terms of pessimistic explanatory style, that we use these thinking traps, which comes from the field of cognitive behavioral therapy, where we think about our stress inaccurately. Like we get into certain habits of catastrophizing stress, you know, only thinking about the worst case scenario, or all or nothing thinking, you know, viewing the stress in a black or white manner, where it's either going to go well or completely badly, or we jump to conclusions about stress. So there's a whole list of thinking traps that we get trapped by, you know, when we're thinking about our stress pessimistically. With good events, it's the opposite. The optimist, you know, thinks that it's a permanent thing, it's pervasive, and it's personal. So they take credit for the good event happening, and the pessimist thinks it's just temporary and, you know, it's a fluke, or, you know, it's caused by other things, not necessarily my effort, and it's just happening in one area of our lives. And let's see here. So I'm going to be posting, or actually I'm going to send to Janet a list of resources from Stanford and from UPenn, where you can actually engage in certain exercises to shift your mindset, to the healthier response, to the more optimistic response. And so I'll just include that. I'll email that to you later, Janet. So that was a very quick explanation of a pretty complex, mindset is pretty complex, especially in the field of health. But they're more and more studying this, because you can think about interventions in the healthcare arena. One intervention they're using is with cancer patients. So you can think about, cancer patients maybe viewing their cancer diagnosis as a catastrophe, and, turning that into cancer can be an opportunity, or their body becomes an enemy, viewing their body as an adversary or enemy, and turning that in, using intervention, that they can view their body as capable. So it can be protective and help with healing. And so I'll just stop here, and if anybody has any questions, let me know. Wondering what the categories of stress are and how these fall in this scheme. Yeah, so I'm not necessarily, I wasn't talking about the kind of stress that's acute and you're, in imminent danger. And the most important thing is you have to get out of harm's way. This is the categories of stress where, it's everyday stress and hassles, but it can also be, just the example I just gave about getting a cancer diagnosis. So something more serious and intense, it could be applied to, more serious stressors as well. The distinction between daily normal stress and chronic stress. So basically, when we, it's pretty well known that when we have a certain stressor and it's becoming chronic and overwhelming, and we're not able to handle it in a more adaptive way, and our body is in a constant state of fight flight, then that, over the long term is going to have negative consequences to your health. Whereas stress that we, handle more adaptively, using mindsets or whatever approach, then our body can get back to equilibrium and out of a stress arousal response. And so those fluctuations where, you're in equilibrium, you have a stressor, you maybe get out of equilibrium, but then you come back into equilibrium, that's the more beneficial state that you want. And I will, let's see, I'm not sure about the question on fertility, and I'll let maybe the doctors, maybe consider.
I added a response to that. There's definitely research on that. Yeah.
Okay. All right. Well, thank you. Thank you for your time.
And now I'd like to introduce Dr. Eileen Yager to do our mind body.
Hi, everybody. Thanks for being here today. I realized that spring is half over. Wow, that really took me by surprise. It comes late in Denver. We have baby leaves now on the trees and flowers, but it's not florid spring yet. Anyway, what I decided to do today was based on that I had an argument with somebody a few days ago, and I realized that some of the things I said were not very compassionate. I said, you better look up something to do a self-compassion practice or a compassion practice. And I found a very nice one. So I thought I would share it with you because I shared it with another group of people and they loved it. So this is adapted from a meditation or practice from the Center for Contemplative Mind and Society. And since we're all home, presumably, or in front of our individual computer or iPhone, we will do this with a mental image of somebody. If you happen to have a person with you physically who you want to include in the practice, that's okay. But most of us will be doing it just with a mental image. So bring to mind, first of all, sit with your feet uncrossed and rest your hands on the lap on your lap, on the arms of a chair, or on a desk, someplace that's comfortable. You can do this with your eyes open or closed, it doesn't matter. So bring to mind a friend or a colleague, a neutral person, or someone who is difficult. In my case, I picked the person I had the argument with who was difficult. And what I will be doing is saying some phrases, and then you silently repeat them, concentrating on that person. So that person is a fellow human being just like you. And let's just do some of these phrases in our minds. This is bringing out the fact that we're very similar. Rather than making you feel separate and opposed to the person, that you are part of this common humanity, which is one of the big features of self-compassion, self-care. Okay, let's go. This person has a body and a mind just like me. So repeat that silently. This person has thoughts and emotions just like me. This person has sometime in his or her life experienced physical and emotional pain and suffering, just like me. This person has at some point been sad, just like me. This person has sometimes been disappointed in life, just like me. This person has sometimes been angry, just like me. This person has been hurt by others, just like me. This person feels unworthy or inadequate at times, just like me. This person worries, just like me. This person is frightened sometimes, just like me. This person will die, just like me. Now let's just spend maybe 30 seconds thinking about the things that you just said and connecting them, or being aware of that other person. Okay, now we're going to continue with a few more phrases. Do the same thing, repeat them silently, thinking about that person. This person has longed for friendship, just like me. This person is learning about life, just like me. This person wants to be caring and kind to others, just like me. This person wants to be free from pain and suffering, just like me. This person wants to be safe, strong, and healthy, just like me. This person wishes to be loved, just like me. Okay, now let's sit for a moment again, just concentrating on the person and thinking of the things that we just thought for them. And now the final part, some more phrases. We do the same thing, repeat them silently, focusing on the person. These are some wishes for well-being. I wish you the strength, resources, and social support to navigate the difficulties in your life with ease. I wish that you will be free from pain and suffering. I wish that you will be peaceful and happy. I wish that you will be loved because you are a fellow human being just like me. Okay, now just focus on the person and the wishes for well-being. And we will end by thanking the person for doing the practice with us. And give thanks in whichever way you feel that it's appropriate. As if you're talking to them in your mind or just saying something, anything you want. Just thank them for doing this with you. And hopefully, this will change your attitude about the other person, even if you were picking somebody that you liked or loved as the subject. And you may find, I'll send a handout and that can be distributed. If you do this over time, a few times, pick different people and see how you feel about it. Okay. Now, as I always say, every time you do any kind of meditation or relaxing practice, you never go on to the next thing without taking a little mini break of 30 seconds where you just breathe calmly to clear the circuits. Then we're going to go on to another practice, the one that Janet asked me to do. Okay. Well, I think sometime in the past I did do this tracing your hand correlated with breath, but it's a wonderful practice that takes about a minute or two. I've taught it to people from 5 to 90. Everybody loved it. You can do it in bed if you're having trouble falling asleep. You can do it anytime that you're, except when you're driving. But you can do it anytime during the day when something is arising. And in fact, I once taught this to a 5-year-old, and the mother was in the room, and she called me up to say that the very next day she had an unpleasant meeting with her boss across a table, and she put her hands in her lap, which is one of the things you can do with this, and did the practice right during the meeting, and it really calmed her down. So it's a very handy one to know. And it's, as I said, tracing your hand correlated with your breathing, and you're going to do a slow breathing, which is like meditative breathing at the same time that you're going to be tracing your hand with the finger of your opposite hand. So you're touching yourself on the hand, and it grounds yourself in your body. Now, some people have told me that when they do it, it tickles. Some people say it tingles. Some people say it just feels like I'm touching my hand with my finger or nothing. It really doesn't matter. So lift up your hand, and we're going to go up the side of the finger, not the back of it. Take the index finger of your opposite hand and put it on your wrist at your thumb. And again, you can do this with eyes open or eyes closed. Now you're going to breathe in, either nose or mouth, doesn't matter, tracing up the side of your thumb to the tip. Okay. And now breathe out, going down the other side of your thumb to the finger web. And pay attention, put your attention on what you're doing. If some extraneous thought comes in, like you have to go to the supermarket later, just let it go and come back to the tracing and the breathing. So we're here in the finger web. Okay, big breath in slowly as you trace up your index finger. And breathe out, down the other side. Breathe in, up the middle finger. Breathe out, down the other side. In, up the ring finger. Out, down the other side. In, up the pinky. And breathe out, down, all the way down to the wrist. Now put your hands in your lap briefly and just tune into how that feels. Just notice if you have any tickling, tingling. If it doesn't feel like anything, doesn't matter. Do you feel like you're a little more connected to your body or not? You may not. Okay. Now we're going to do it with the other hand. I won't do as much talking. I'll just say in and out. And you notice it's a slow breathing. Okay. Index finger at the base, at the wrist, base of your thumb, and go in, breathe in, up the side of your thumb to the tip. Breathe out. Breathe in. Breathe out. In. Out. In. Out. In. And out, all the way down to the wrist. And again, rest your hands in your lap. Tune in to how you feel. And also check both of your hands to see if they feel the same or different. There's no right and wrong for this. It's just being mindful, being aware of how you feel and what's in the present moment for you. Now you can repeat this practice as many times as you need. And as I said, the only time you really couldn't do it is if you're driving. You have to be able to spend a minute. It's a minute, 2 minutes. I don't even know how long. No, it was certainly not more than 2 minutes. And you could repeat it as often as you need, as many times during the day as you need. And it's a safe practice. It was actually developed for kids who were about 12 years old, I think, originally. But if you have friends or family members or anybody that you think would benefit from this, please feel free to teach it to them. And, I'll send the handout for it. Okay. Tracing the hand correlated with the breath. So I call this a mini meditation in action. I won't do what I was planning to do originally, because the last practice that I want to do with you is one of my very favorites. It's a practice, like an imagery practice using light. And I've done this for many, many years and done it with lots of different people. And it really is fabulous practice. So let me tell you what we're going to do, and then we'll do it. You have to sit with your back straight, close your eyes for this one. If that's not comfortable for you, then look at something in the lower field of vision and stare at it so your eyes are not darting around, but it's better if you can do it with your eyes closed. And this one, we're going to be inhaling through the nose and visualizing white light coming down from the top of your head, down your spine to the heart level in the back. That's as you inhale, white light. Then you exhale through your mouth, visualizing sending golden light out through your heart in all directions, as 360 degrees. So you end up sitting in a globe of golden light. And you breathe at your own comfortable rhythm, in through the mouth, white light comes down from the top, down to your heart, in the back, in your spine. And then you exhale through your mouth, globe of golden light. It's very relaxing. If you don't like inhaling through the nose and exhaling through the mouth, it's okay to do it through the nose both ways. The other thing that might help is to drop your shoulders with each exhalation. That helps your body to relax. And we will do it for about 5 minutes if we have the time. Okay. Close your eyes or look at something down low. Inhale through the nose, visualizing white light coming down through the top of your head, down to your heart level, down your spine. Then exhale through the mouth. Golden light comes out all directions, and you're sitting in a globe of golden light. Go ahead. Okay, and now become aware of yourself in the chair. Feel the chair against your body. Feel your feet. If you like, you can wiggle your fingers and toes a little bit. Take a deep breath. And as you exhale, as you breathe out, slowly open your eyes, come back here, and sit quietly, breathing at your own comfortable rhythm. So if you like, this can be a meditation, which you can do for 15 to 20 minutes. I wouldn't do it longer than that. Or it can be just a very brief practice that you do just for a couple of minutes, but just make sure you sit quietly, enjoying the relaxed feeling after you finish and open your eyes. And again, this is a safe practice. If you want to teach it to someone, the kid can't get into trouble with it. Some people ask me, well, could I inhale golden light and exhale golden light? Yes, you can. Can I inhale white light and exhale white light? Yes, you can. None of these things are etched in stone. They're all variations of universal practices that are found in many traditions. Right. I'm sure Misha knows this one that we just did. Yeah. Okay, well, thank you for coming and enjoy the spring. And Janet, I will send you a revised handout. I'll do it now. So, and then you can, I'll leave out the middle practice that I didn't do. Okay. Bye-bye.
Thank you, Dr. Yager. Thank you, Ashley. Thank you, Nina. Thank you, everybody.
Take care.
Have a good weekend.
Bye-bye.
Bye.
Hey, how can they do it? Oh. Oh, gosh, I don't know how to get over here. What was it?